whole thing, and as we look again, as we look at GMH, this is another stopgap
That's right.
measure. Yeah,
That's right. Absolutely. First of all, thank you very much again for having me here. Yes, the bill that we passed, the legislature, it is really a stopgap measure. It was for the governor to go out to the bond market and refinance existing bonds that we had already, and number one, be able to obtain lower interest rates on those. So the rate that they got this time around is record low, 3.3%, I believe. So there was a Section 30 bonds that were refinanced, the Okadu bonds, as well as the GMH Bank of Guam loan that was refinanced, all at a savings. And so what we did was after that was go out and get an additional 45 million. Initially it was 30 million, but with the additional 15
million.
So it was 45 million. And that was to pay down the vendor payables over at the hospital that haven't been paid for a year, 2 years. So it gets them back on their, on their foot, and it gives an opportunity to again get some supplies that are badly needed at the hospital. And so in the interim now, the whole idea here now is to really come up with a comprehensive plan that that the hospital won't have to come back and resort into a bailout again in the future. I know that we've talked about that, not in the 2 years, 3 years, but for decades we've been talking about this problem with the hospital, on how it's always going to rely on a subsidy. And in any business, Senator, is that when you have people come in and seek your services and don't pay for it, you're going to have this situation. Right, and so our hospital is set up that way. We have
it's basically a free institution.
That's
basically,
right.
yeah.
Absolutely. We have a mandate to provide care to our people, regardless of their ability to pay.
That's right.
And so, but there's an opportunity here. Last year I put together a task force comprised of private and public stakeholders, and we looked at the whole the problems of the hospital for decades, for over 30 years, and looked at the solutions that were brought to the table in the past. And now really have developed what I call a 10-point plan to address the problem of the hospital. And it's not, this 10-point plan doesn't just focus on the hospital like we've done in the past. And so I think that's the biggest difference, is that we take a look at healthcare in general.
Holistically looking at healthcare. Yeah.
That's right. Because when you just, have if you're tunnel vision, just say, okay, we're going to patch up the hospital, give them the money, to pay down the vendors and give them more money to build up and do capital improvement, it's not going to solve the problem. One of the key components of this 10-point plan is to expand health insurance access for our people. We have about over 30,000 individuals who don't have insurance. And most of these people
considered self-pay, right?
Self-pay, and most of these people are working individuals, people that work in companies that, for one reason or the other, the employers don't provide health insurance, and most that we've seen are really the small business owners, because and I understand we're a small business owner also. At one point, we understand that it's difficult when you have an operation that's very small. You rely on every dollar, every penny that comes into you, and so having benefits for employee, it's something that you want to do, but you say maybe later when the business gets better, we'll provide.
And you strive for that.
That's right. Absolutely. I think our business, our entrepreneurs here really strive for that. Just like you said. So we're close to releasing a plan that would provide that, at least for in the initial stage, about 15 to 16,000 individuals to get them insured into a health insurance plan. So I feel that that's one of the biggest ways that we can really solve the hospital's problem long term. And by doing that, it's not just solving the hospital's problem. It really makes for a healthier community. Because
but let me ask you this too, because when you're saying about small businesses, okay, again, and of course small business, like for example, if they start out at thingy, like Chamorro Village or all that, right? That's an incubator program. That's so they're in need of the government's assistance as well to help them out, right? Now, most people don't start down there, but they're also in need. They have their operations. They're in the red, right? They're in the red, yeah. And so that being said, I know it's not your bill, but I know there's a bill out there to mandate health insurance to an organization. I know that organization opposes it because it's they say it's discriminatory, and you know there's no studies that say this particular industry is what's contributing to again to the delinquency of bills and non-payments and all that. But you saying your 10-point plan is inclusive of some kind of mechanism to allow health insurance, but short of saying mandate it, right?
That's right.
Yeah. So how does that kind of work?
Well, you know what we've been working with the organizations like the Guam Hotel and Restaurant Association. We reached out to the Guam Chamber. We're working closely with the Society of Human Resource Managers, a group of individuals that are the human resources of these companies, and so. Because I know that to have a successful program in place, we must work with them and involve their input. And so, you know, we are at a point and stage now that we have provided them that, you know, the concept of what we're looking at. And I think the mindset is really what, you know, what has to change with the individual, with the employee, with the employer, and with the government as well. You know, now we think, okay, we have the public programs, the MIP and Medicaid, and if you don't qualify for that, and your insurance and your company doesn't offer you, then you're just out of it, right? And there's no desire or I shouldn't say there's no desire. Some people do desire to have insurance, but there's just no way to do it. But the mindset that has to change is that we all must be responsible for healthcare.
You all have to contribute to it.
That's right. And so, you know, now the companies that I know are resistant to a plan such as this to somewhat mandate or have them involved in a health insurance program, we tell them you're already paying for it now. Even if you don't offer it to your employees, you pay for it now in your taxes. You know, we've seen our medical costs escalate at a very fast pace. And that's because, you know, someone has to pay for those that go to the hospital and can't pay for their you know, for their bill there. So instead of the back end of funding it in the back end, we fund it in the front end. And that's the mindset we're trying to get you know, across, is that if you fund it in the front end, then you know, we can have a healthier community, and the cost in the long run will go down.
Well, one of the 10 points, one of the things you looked at as well as you met with your task force that came together was a public-private partnership. And I think at this point, I think Gita out for a request for information. I think it is. Where is that at, and what kind of input have they been getting? Because if I was a private industry as well and said, hey, you know, I can possibly do that, but I would definitely look at profitable entities of an organization and say, hey, okay, let me take that. The ones where you're hemorrhaging, I probably would not want to take that entity. So how was the reception been with Gita in the request for information regarding, again, what the task force you put together recommended to go out in a public-private partnership?
Yes, I know from the initial discussion with Gita, there was a couple of entities, organizations that did receive, that asked to be received this packet for the request for information, and also there were some that Gita had also just on their own went out and provided the packet for them to review. I believe later this month is when that closes, when the submissions are to be turned in. You know, but I've always said from the very beginning, you know, we could get a bunch of responses, or we can get none. Or zero. You know, but this process is just the request for information, just to go out there and see what, if any, interest is out there, because we also have to look at a different business model, you know, for the hospital.
I've said that all the time.
And it's never. Some people had looked at it and said it's privatization. Number one, we cannot privatize GMH. It's a mandate, Organic Act mandate,
not on the existing mandate.
That's right. Is that we must care for our people, and the ultimate responsibility, the operation of a hospital, is with the governor of Guam. So we can't change that, and I don't plan to change that. But I think there are services there that we could partner with the private sector. We have now a brand new hospital that's here on island. We hear about services that they have there, but they have have to shut down because they don't have the nursing, they don't have the some other components to make it work.
Yeah.
And that's the focus now. Also is getting them to sit down with GMH and seriously come up with some sort of collaboration, because at the end of the day, we serve the same people.
Yeah,
it's our people.
I got to pay some bills. We'll talk more about this on the other side of paying the bills.
Thank you.
Be right back.